Hello friends, so today let's see what are the investigations and when investigations has to be done to diagnose your COVID-19. Now first of all let's see Rtpcr, that is reverse transcriptase real time PCR. This is your gold standard frontline test. Here SARS-CoV-2 virus is an RNA virus. So this RNA has to be converted to a DNA before it is transcribed. Now PCR is done. Polymerase chain reaction is done to confirm your diagnosis. So it will be detecting 3 genes: E gene, N gene and RtRp gene. E gene stands for envelope, N gene stands for nucleocapsid, RtRp stands for RNA dependent RNA polymerase. Okay, this is your gold standard to diagnose your COVID-19. So what are the other tests? So we have antigen and antibody detection tests, that is rapid antigen detecting test. This is similar to your point of care testing. What is point of care testing? Point of care is nothing but your test, your bedside test, similar to your glucometer, wherein the patient himself can perform the test and the result will be ready within few minutes. Okay, so how do you interpret this test? If you get a positive result, it means you need not do your Rtpcr. If you are getting a negative result, it doesn't rule out your COVID-19. Negative means you have to do Rtpcr. So here results will be available within 15 minutes. You will have to put a sample in the well and then wait for the appearance of the test line. Test and control you will have to wait for the appearance of a line. You can discard the kit immediately after use, while storage of the kit is 2 to 30 degrees Celsius. Now moving on to the antibody detection test. You can detect your IgM and IgG antibody. So here you are going to take either blood or serum or plasma. You are going to put a drop into the sample well and wait for the line to appear. In case of positive, how do you interpret this? In case of positive test, it means you are exposed and then antibodies have been developed. In case of negative, it doesn't rule out COVID-19. So this is not used for diagnosis. It is used only for surveillance purpose. Okay, so here report will be available within 30 minutes and the positive result will be coming only after 7 to 10 days of infection. That is, when you come into contact with a COVID patient, after 7 days you do the test, only then it will show positive. Okay, next moving on to the screening test. What is it known as your TrueNAT. So it is the first line screening test. It is principle is chip based real time PCR to identify your beta coronavirus. It is a semi quantitative detection technique. The sample used is nasopharyngeal swab. Positive result, if the test is positive, it means the patient may have COVID-19. It has to be confirmed by Rtpcr. The test time is 1 hour. Within 1 hour you can get the report, and you can store this kit at a temperature of 20 to 30 degrees Celsius. Okay, so this test is mainly used in containment zones to screen who are all having disease. Okay, all symptomatic influenza-like illness, healthcare workers and suspected patients. Asymptomatic high-risk groups can also be tested. Here the test taken is only nasopharyngeal swab collected with proper PPE. The test is conducted under strict medical supervision and you can get the report within 1 hour. Okay, so these are the tests. To summarize, to confirmatory diagnosis is Rtpcr, screening test is TrueNAT, and rapid antibody test is not for diagnosis but for surveillance purpose, and you have rapid antigen test which does not confirm your diagnosis. If positive, you need not do the test. If negative, you will have to do the test. Okay, thank you.